Hello, my name is Sean Gallagher, and this is part 2 of breathing, preparation for birth. So to start, just a very quick review. In childbirth, we divide the process of having a baby into these arbitrary stages. First stage is early labor and active labor. You may also see in some places where they talk about transition. The first stage is the cervix ripening and opening. Second stage is pushing and the birth of the baby. Third stage, birth of the placenta. Fourth stage, the postpartum period. Now, as we look at the research in pain management, and we have two sets of stats here. One is Canadian, one is American. In that first column on the left, for breathing, the majority of women in the Canadian survey said that they used breathing for birth, 74%. Not many of them found it very helpful, 32%. In the U.S., 49% said that they used breathing, and again, low rates of women reporting that breathing was actually helpful. So we're assuming that this is for purposes of helping with natural birth. When we compare that to water immersion, in Canada, it looks to me like the stats are referring to either a bath or shower. In the U.S. statistics, we're looking at tub or pool only, which is probably what explains the difference between 32% of women saying that they used water and only 6% of women using water. In Canada, in general, the stats for being in a tub are probably low, like they are in the U.S. Most labor and delivery units in hospitals in Canada have showers. Not uncommon for women to maybe get into the shower for a bit. Rather uncommon for women to actually get into a tub. But we're seeing higher rates of satisfaction for pain relief. So in general, tubs are referred to as a midwife's epidural. It's not the same as an epidural, but it's quite profound in terms of the helpful effects for pain management. In order for a tub to be the most helpful, it works best for the water to be completely covering your belly, so water that just comes up to your hips is not really going to do much for you. Being in a deeper tub where the water's coming up to the top of your belly or the breast area, underarm area, that's going to be the most helpful. And as we compare breathing and water immersion to epidurals, so epidurals are an anesthetic using a cocaine-based drug, Marcaine, and a narcotic called fentanyl. So the combination of these drugs that go into a space in the spine called the epidural space that causes quite good pain relief from about the waist down. With epidurals, women are not able to walk, and so typically they need to stay in bed once they receive the epidural. The majority of women in both Canada and the U.S. found epidurals very helpful. The lower rates in Canada in terms of epidural use as compared to the U.S., but it's quite possible that these stats are fairly similar. The epidural rate in the southern GTA, Greater Toronto area, my understanding is it runs around 75% or so, so it's going to be higher in cities than it will be in rural areas. And if you look at the U.S. stats, 81% say epidurals very helpful, 10% somewhat helpful, which would leave 9% indicating that epidural is not at all helpful. So even though breathing doesn't have the kind of profound effect that, say, a tub or an epidural would have in terms of helping manage the contractions, it's still a really good thing to be able to have available to use, which is why we're reviewing it. So as we look at basically the short version for breathing, you just want to be breathing slow, in and out through the nose. You want to be breathing into your belly. So that's what we're aiming for as much as possible. There's going to be some variations on that, and there's a lot that will change based on how the birth progresses. But you just know, slow belly breathing in and out through the nose, that's going to be most helpful for you. Of course, during the pushing stage of the birth, we naturally will hold our breath, and that's just a natural part of what happens with pushing. So we'll be going into more of the detail of all of this. As we look at breathing and pain, we know that just slowing our breathing down, allowing for breathing into the belly, helps with the process of relaxation. We know that longer exhales help the relaxation response be more available in the body. Breathing helps with pain management because it just allows more oxygenation to the cells, and when the cells are better oxygenated, we don't feel the pain in the same ways. That's just always a good thing in general. And as a distraction, focusing on our breath just helps us to not think about what's going on elsewhere in the body. And of course, breathing is portable. It can be used anywhere, anytime, and with any of the comfort strategies that you want to access. So if you take a moment, put a hand on your belly, hand on your chest, like we did before. You want to drop your shoulders, let them relax, get comfortable, just sit up a little bit. As you allow your posture to be more upright, it just gives more space for the lungs, relaxing your jaw. And we'll just take a minute, and as you just let yourself breathe in through your nose, out through your nose, I'll tell you when to start the minute, and then you can just start counting your breaths. Each inhale and exhale would be one breath. So getting ready, starting now. And the minute's over. So you just mentally record how many breaths that was for you, what is natural for you, at least right here, right now. And how easy or challenging perhaps it is to breathe down into your belly. Just noticing that. And maybe just kind of letting this minute that passed to just kind of settle into you, and just let that place perhaps of greater calm or peace to just stay with you over the next little bit. As we move to talking about hyperventilation, and hyperventilation is essentially over-breathing, so breathing too much. And with hyperventilation, what we end up doing is releasing too much carbon dioxide. And in general, carbon dioxide is seen as a waste gas, something not that important, but it's actually very important in the body. When carbon dioxide levels raise in the tissue, that's a powerful signal to the red blood cell to release oxygen. If the red blood cell is coming to the tissue and the carbon dioxide levels are lower, then it just will keep on moving. It won't release the oxygen, and the tissue's not getting refreshed in a way that it should be with oxygen. So too little carbon dioxide is a problem. Now, there are some people who say that we're in a chronic state of hyperventilation, that we're breathing off too much carbon dioxide through the way that we breathe, and that will be the presentation in the third section on breathing. Now, we theorize that the reason why hyperventilation happens is chest breathing, so breathing more shallow, high up in the thoracic cavity, breathing too quickly, breathing in too much air. Because whatever you breathe in, you have to breathe out. And when we're doing yawns or sighs, gulping air, forcible exhales, then all of this is going to release too much carbon dioxide, not a good thing. Now, if you've ever had this happen, you know that it creates this feeling of being lightheaded, dizzy, tingling, typically around the fingers, feet, the mouth. And there's a feeling of not being able to get enough air, and that can feel quite panicky. So in general, when people have a panic attack, there's often hyperventilating that goes along with that, which adds to the panic. Hyperventilation tends to sound like when it's quite pronounced, but again, we can be in states of more mild states of hyperventilation and not quite know that that's happening. So what to do? What you want to do is rebuild your carbon dioxide levels. One way to do that is to cup your hands over your mouth. If you have a brown paper bag, in a birth room, you could put a surgical mask over your mouth. You want to pause on the exhale. So you take a breath in, exhale, and at the end of the exhale, then pause. And just wait until your body's got a natural kind of air hunger, and you naturally, physiologically want to take a breath in. As best as you can, breathing quietly. So that's also going to help reset your breathing. So refilling carbon dioxide levels. Again, exhale, pause. So you're not taking an inhale and holding it. You're exhaling and not forcing out a lot of air. You're just doing a natural, just let your lungs kind of rest back. And then on that pause, just wait for the next inhale. Ideally, that natural pause is about 40 seconds or so. People who are hyperventilating will have shorter pauses, so might be 15 seconds, might be 20, 25 seconds. So again, this is also something that can be retrained. At this point, it's not that important how long the pause is, but just to know that it does vary from person to person. You also want to refocus on relaxing, maybe getting into the shower or the tub, changing a position. Maybe a partner can massage your shoulders or some other part of the body. Just letting go of tension. It can be helpful for partners to remind you to slow your breathing down, and the kind of internal dialogue that you can give yourself along the lines of, this too will pass, I can do this, it's just panic, or I'm breathing fast and I'll be able to get my breath, everything will be okay. So in general, for breathing, if you're breathing slow, you want to be breathing into the belly, deep into the abdominal area. Whenever we breathe more quickly, you want to have more shallow breaths. As best as you can with your breathing, just allow a pause at the end of exhale. So if you're paying attention to your breathing, just wait until your body has a natural response of wanting to inhale. If you want, you can also pause on the inhale and then just also wait until your body's ready to exhale. You often see these types of breathing sometimes in yoga classes and other places where you breathe in for 4, hold for 4, out for 4. That kind of timed breath can sometimes be helpful for people. If you find it helpful to exhale and have an audible sound to it, a kind of a Then again, with all of this for childbirth, is just do what works. So whatever helps you, there's no right or wrong in this, just do what works. It's generally better to breathe in and out through the nose. So if you want to be making noise, then humming can be really helpful. It allows you to breathe in and out through your nose. And that actually helps rebuild carbon dioxide as well, which is a good thing. Just a reminder, if you're feeling dizzy, lightheaded, tingly, as best as you can, pause on the exhale. And you may be able to do this during contractions in the birth. If not a big deal, use the rest period, because the rest period between the contractions, it's comfortable. Assuming your baby's in a good position, during the rest periods, you feel great. The uterus is not contracting and you feel fine. So use the rest period. Reset your breathing. Get yourself back to a slower, deeper breath. So just some tips for partners, or if you have a doula with you, or partner and your doula. It can be helpful for support people to remind yourself to have some slow breaths. If you do an audible exhale for her, if she's breathing fast, and then you take a breath in and then do a nice, slow, long, deep breath out, then she's going to hear that, and that's going to be usually a helpful reminder. Good for support people, for you to just check in on your body from time to time. Just release tension and remind yourself to relax and let go. Keeping eye contact with her can be very helpful. Sometimes partners find it helpful to move a hand up and down. So you move it up with the inhale, down with the exhale. So if she's got her eyes open and she's watching you, she's connected with you, then that could be quite helpful too. So again, helping her reset her breathing in the rest periods is always easiest. Can be done in the contractions. Depends on a number of variables. And things like breathe with me now. In 2, 3, 4, out 2, 3, 4. For some women, it is helpful to do the ha 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 hoo, that's the Lamaze breathing. And just reminding her that she's at the halfway point in that contraction, that you can do this. The contraction's coming down, it's letting go, that you'll never see that one ever again, that contraction, that she's doing this work for the baby. So as we move to the stages of birth, just a very quick review. First stage is early labor and active labor. Second stage is pushing. You want to ignore early labor as much as you can. This is where the cervix is mostly ripening. In active labor, the cervix is mostly opening. So this is the part of the birth where most of what you're learning here with breathing is going to be the most helpful for you. For pushing, you're going to get help from your midwife, your nurse, your doula, whoever's with you. So they'll be helping guide you through that process. If you're in a tub in the hospital, they will want you to get out, unless there's a plan for a water birth, but in general, most hospitals don't want you in the tub during the pushing stage. And just to know that if you're having an hour of being in the pushing stage, assuming the contractions are, say, every 5 minutes, you only push during the contractions. So the contractions are a minute long, generally speaking, in the pushing stage. You'd be looking at actually pushing for 12 minutes in that hour. The rest of the time, you're just having a rest period between the contractions. So early labor, you want to just do calm breaths that help calm you down. So slow belly breathing, longer exhales into the nose, out through the nose. In active labor, it's natural for breathing to speed up. So most childbirth educators don't teach you to breathe fast or to practice fast breathing. We want you to actually practice slow, deep breathing. But if you're finding that your breath is speeding up in active labor, that's normal. It's not a big deal. Usually it'll speed up around the peak of the contraction. You may find it helpful to vocalize, repeat a mantra, a hum. That might be helpful for you. It is helpful for some women. And if you're breathing rapidly in and out through your mouth, then you want to refocus and get back onto slow, deep breathing in the rest period. With pushing, there's a whole discussion around what's called physiologic management of second stage, or just pushing the way your body wants you to push, or directed pushing where the care provider is telling you exactly how to push. So we'll get into that in a bit. Usually they'll want you to slow down pushing at the time of crowning. So as the baby's head is being born, helping slow that process helps the tissue to stretch. And then there's a couple of other aspects about pushing that we'll cover as well in a bit. The J breathing and breathing your baby down. So early labor. Again, really quick review. The contractions are generally every 5 minutes. This is what we would call the 511. Cervix is thinning, it's ripening. This can be quite lengthy. For some women, it can last days. So you want to ignore it as much as possible. Slow, deep breathing. Making sure your shoulders drop down, your body's relaxing as best as you can. And in childbirth, there's something called a cleansing breath. And cleansing breath is just a fancy phrase for slow, deep breath at the beginning of the contraction and a slow, deep breath at the end of the contraction. That can help people in the birth room recognize that there's a contraction happening, and so you may find that helpful. So avoiding mouth breathing, rapid breathing, but if that happens, just reset yourself in the rest period and slow things down. So in early labor, belly breathing, into the nose, out through the nose. Drop your shoulders, relax your jaw. You might find it helpful to breathe down into your baby. If you're having 6 breaths or 10 breaths, however many breaths that is in that minute, then you know that the halfway point, at that 3rd breath or 5th breath, that the contraction's coming down, that you're going to be okay because you're moving into the rest period. And again, just a reminder of timing contractions. So we time from the beginning to the beginning. Now on this chart here, the contractions are every 3 minutes, lasting a minute, which gives you 2 minutes of a rest period. So timing contractions from the beginning to the beginning. There are apps. Might be helpful to just write it down on paper. And just a reminder about the private link that has the early labor video, making sure that you've got some good strategies on coping with early labor. And staying off digital devices, especially at nighttime, staying off computers, because the light that's emitted from digital devices affects the pineal gland in the brain, and that affects our capacity to make melatonin and to help us sleep. Just maybe use pen or paper, find some other way to make notes, but you don't need to time every contraction. That's not something that you need to do at all. Active labor, the contractions are closer together. Usually we're looking at 3 in a 10-minute window. This is where the cervix is opening. First babies, average length is 12 hours, second baby's 8 hours, but of course there's going to be people who have much longer labors, much shorter labors, so that really varies. There's a lot of variation in all of that. Again, as slow and as deep as possible. And if you find yourself breathing faster over the peak of the contraction, so say in a 60-second contraction, It's from the 20-second mark to the 40-second mark. It might sound something like this. That's normal. It's not a big deal. Don't stress out about it. You just want to start slowing your breathing down, at least by the end of the contraction. If you can start slowing things down around the 40-second mark, that's awesome. But just make sure you're getting some nice slow deep breaths happening in the rest period. Calming thoughts also help with calming our breathing, help us with feeling better. Come up with some ideas of things that you can tell yourself, things that your partner can repeat to you that you find reassuring, helpful, supportive, calming, then that can be a good thing. In the hypnosis classes, we usually have some ideas of positive suggestions for self-talk. That's just a very personal thing. It's going to be ones that you like, ones that you don't like. So in active labor, slow breathing, into the nose, out to the nose, belly breathing. Contractions are 60 seconds, the middle 20 seconds is usually the most challenging part, so breathing faster over this period is not a big deal. And you may find it really helpful to do the cleansing breath to start and end the contraction with just a slow deep breath. So as we see this chart, the phases of the contraction, at the peak of the contraction is the word acme, just meaning the peak. So if you imagine just the 20-second mark to the 40-second mark, that middle third of the contraction is the most challenging part. Rest period, the uterus is totally relaxed. Assuming that there's no Pitocin being given intravenously, as long as your body's doing the natural contractions that it makes, natural oxytocin, the uterus is completely, totally, utterly relaxed. With Pitocin, of course, the uterus has some residual tension in the rest period, so that's a different scenario, but as long as it's just natural labor that's happening with your body's natural oxytocin, then there's complete relaxation that happens. So in general, the recommendation in most prenatal classes, do the cleansing breath at the beginning and the end, slow deep breathing as much as you can, and then there's usually some teaching around different types of more rapid breathing, even 30 breaths or more in a minute, and that's going to be high up in the chest, shallow breaths. I don't really recommend you practice this. I don't recommend you even use it in the birth. If you want to breathe more rapidly in the birth, that's fine. It's not a big deal. Just get yourself resettled with slow deep breaths in the rest period. Mouth breathing can cause a lot of dryness, so there are some strategies to help with just creating more moisture. You should be able to be consuming fluids in your birth. Check with your care provider. A lot of hospital birthing units still don't allow eating and drinking, even though the research shows that that's based on really old evidence and is not scientifically based. So double check with your care provider if you can be consuming fluids in the birth. And the other kinds of breathing that you might find helpful, including the sleep breathing, so the longer exhale, yoga breathing, repeating a mantra, vocalizing. All of those can be quite helpful. Now, pushing in general, average length of time is 2 hours for a first-time mom. If somebody's on an epidural, it's going to be generally longer. Average length is 1 hour for second birth or subsequent births. And again, if you're pushing for an entire hour, you're working for about 12 minutes. If somebody's pushing and she's lying on her back or she's sitting, that tends to compress the sacrum, which is the bone in the back of the pelvis, and that reduces the amount of space available for the baby to rotate and to descend. So different positions really can help during pushing to allow more space for the baby to slide down and out easily. During the second stage of birth, The cervix is fully open. We talk about a couple of different aspects of the pushing stage. Late in second stage, there is no urge to push. Active second stage, there is an urge to push. Most women, when they get to 10 centimeters, they want to push, but there are some women that they just don't have an urge at 10 centimeters. And then some women have an urge to push and the cervix isn't completely open, so that's called a premature urge to push. Contractions can be every 2 to 5 minutes, lasting 60 to 90 seconds. So that just really varies from person to person. You push with the contractions. Usually midwives arrive at the start of pushing. It's a matter of kind of juggling things for the primary midwife to inform the second midwife. For physician-attended births, usually doctors show up about 5 minutes before the baby is born. The baby's head is flexing, rotating, coming down. Crowning is the last part of the pushing stage. It's the shortest part where the biggest diameter of the baby's head is presenting. And then, of course, the birth of the shoulders and the body. Physiologic second stage is pushing when your body tells you to push. You push as much or as little as feels appropriate for you. Open throat. So you may find yourself making noise. You might exhale with the push. Directed pushing is what we see in a lot of birth videos and TV shows. We call it purple pushing because mom's face goes purple. Sometimes women will have broken blood vessels in the eyes. It's also called Valsalva maneuver or Valsalva pushing, where women are generally on their back. They bring their knees up to their ears or chin to their chest, and they push, 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 harder, harder, harder. Partner is often told to count slowly to 10. The care provider will put fingers in the posterior part of the vagina and press down to create some pressure into the rectal area and tell women to push that feeling out. There's a lot of criticism these days around directed pushing for some good reasons. We'll talk about that in a bit. And then some of the other aspects around pushing. With J breathing, we'll talk about that in a bit. Breathing your baby down. Laboring down is when the woman is on an epidural and the epidural stays topped up. They just wait to see baby's head on the perineum. So that's going to be a longer pushing stage, but it's a kind of an innovative way of using an epidural. There are a lot of criticisms about directed pushing, mostly because it's not good for the baby, not good for the mom. So baby's heart rate will often drop, and baby's not getting the oxygenation that baby should be getting. It has some internal effects for women, and it's not good for the perineum. That could be a discussion that you'd have with your care provider around how to handle this. In general, you can assume that if you're having your baby in a hospital and your care provider is a family practice doctor or an obstetrician, that the nurse will be handling 95 or more % of the pushing stage. And generally, this is the way nurses have been trained. So they tell women to push quite aggressively and get them into positions where they're on their back, which can work quite nicely if somebody's on an epidural. But if somebody's not on an epidural, she doesn't need to be on her back. She can stand up, she can squat, she can get into different positions. So if a premature urge to push happens, it's probably because of baby's position. So probably the baby's posterior or something else is going on position-wise. And that's why we generally recommend that you start changing positions lying on one side for maybe 5 minutes, the other side for 5 minutes, back and forth that way. Some of the other things like climbing stairs, lunges. The double hip squeeze is basically partner is pressing the pelvic bones in just to sort of open up the lower pelvic cavity to create more space for the baby. So there's lots of different reasons why this might be happening, different ways of helping it. In terms of breathing, general recommendation is just short, shallow breaths as a distraction to help prevent adding to the pushes. The uterus will push by itself. You're just not wanting to add to it in general. Sometimes it works quite well if there's an urge to push with the urge. It just really varies depending on what's going on in the birth. But if it's to do with baby's position, you have to get the baby turned and in a better position. And then usually that just kind of fixes the problem of a premature urge to push. Usually the cervix will just open up and everything's good to go. So it can be helpful for partners to just make sure you're looking after yourself. So making sure that you're breathing is relaxed as possible, that you're eating, that you're consuming fluids, that you're looking after yourself, because the better shape you are in, the more you're going to be able to help her. So just some nice slow deep breathing for yourself, and that can help her get into a nice rhythm as well. So when the body wants to start pushing, it's pretty obvious. The body will do that itself. It happens spontaneously. Most women will want to push at the peak of the contraction of that minute long or however long that push lasts. And that's just, for most women, a really good feeling. Most women quite like that feeling. And in general, the thought is holding your breath for about 3 to 5 seconds is a good process physiologically. That's going to be good for you, good for the baby. With directed pushing, what I've seen a lot happen is that nurses are being quite loud, telling women, hold it, longer, keep your breath in, push, harder. So again, talk to your care provider about how to approach all of this, but one way to handle that, if that's happening and everything's okay with you, everything's okay with the baby, then just go with what your body wants you to do and just sort of do the pushes that feel right for you. Usually, too, in hospital settings, nurses don't want women making any noise. Sometimes midwives are like that as well. And again, just be open to working with your care provider on this. If you're exhaling with the push and breathing out, then a lot of people would say that that's a good thing. The information on the Preparing to Push course, that's an online course, can be quite helpful for a lot of people. And that can help you with having just a really good, strong perineal floor after your baby is born. J breathing or J pushing just refers to the letter J. So babies have to come down and around the pubic bone. So if you imagine the letter J, the swoop of the J coming down through your pelvis and then curving around towards your pubic bone so that you're pushing your baby down and under the pubic bone, down and out. For some women, that can be very helpful just to visualize that shape. And in some childbirth preparation programs, they will say that you want to breathe your baby out. And some women come away from that thinking that they don't have to push. And that can be the case for somebody, say, having a second baby or any baby other than a first baby. But typically for first babies, we need to work and we need to really help the process. So breathing your baby down is a great idea, but it doesn't work usually all that well for first babies. Usually we have to be quite active with helping the process of getting babies out. And then as we come to crowning. So crowning is the baby's head. We're assuming that baby's coming first. So crowning is the baby's head, presenting the tissue stretching quite a bit, and it just feels like a lot of pressure. It's not a lengthy process. It might be a couple of minutes max. So it's over with pretty quickly. The way babies' heads are born, the chin is tightly tucked to the chest, and at the time of the head being born, the chin just lifts up. And you just want that process to be smooth. If the baby's chin lifts up really quickly, it can cause some tearing in the perineum, and so you want that whole process to be smooth. So in general, what your care provider will want you to do is push, don't push. Push, don't push. So you give a little push, and then you might pant or blow. So typically they'll tell you to pant or blow. So, okay, give a little push. You give a little push. Okay, now pant or blow. So that's kind of what it sounds like. And that one push to deliver the baby is just kind of a bunch of smaller pushes over that minute. And then once your baby's head is born, the shoulders are usually born pretty quickly, and the whole baby is out right away. Delivering the placenta is really easy. It's small, it's squishy. If you're in the hospital with a family practice doctor or an obstetrician, you're pretty much guaranteed that there'll be an injection of Pitocin in the thigh after the baby is born. Pitocin is designed to help the placenta separate and then deliver. Usually the placenta is born within about 5 minutes after the birth. Talk to your midwife, if you have a midwife, about that process, if they do routine Pitocin after the birth or if they just do a wait and see. If they do a wait and see, it's usually about 15 to 30 minutes, and then the placenta is delivered pretty easily. Usually they'll just give a bit of a tug. It slides right out. You'll need to give a little bit of a push, but it's pretty straightforward. So just for partners to remember, if she's breathing faster over the peak of the contraction, don't sweat it. It's not a big deal. Just remind her after the 40-second mark or so, definitely by the end of the contraction. Something like, when you're ready, just take a slow deep breath. Or as the partner, you may just do just a nice slow deep breath so that she can hear that. Any hyperventilating, have her cup her hands over her mouth. Help slow the breathing down. Any positive suggestions, ideas that you can kind of flow her way just to help her get through that contraction would be great. So in terms of directed pushing, just some tips that might be helpful. Just on the topic of directed pushing, just a quick review and a general review overall. As much as you can, just in life. Breathe in through your nose, out through your nose, belly breathing. It's just helpful physiologically. To maybe talk with your midwife, your doula, around some strategies of how to avoid purple pushing or the directed pushing. As we take another moment now and just allow you just this minute to kind of absorb. There's a lot of information around breathing. The general approach is slow and deep. So hand on your belly, hand on your chest, drop your shoulders, relax your jaw. And for this moment, to just allow yourself some nice, slow, deep breaths. And if you want, you could maybe go to a happy place in your mind. And as you go to a happy place in your mind, you could imagine that you're breathing in calm. And maybe that calm has a particular color or colors. Maybe imagine that going down into your belly, down into your legs, into your feet. You might imagine any tension, tightness, or discomfort turns into a liquid light that you can just release into the earth. Just let that go. And as you breathe in, some happy feelings, calm or peace. Just let this good feeling be with you so that when you're ready, you come back into the room, bring the good feeling with you. And thank you for being with this presentation. If you have any questions, give me a shout. SeanGallagher.com, 416-255-8333. I welcome questions, comments, any feedback, what's helpful, what you liked, what you didn't like. It'd be great to know. And then there is another presentation on some more advanced information about breathing in general that you might find helpful. But in general, this presentation, breathing, early, active, and pushing, is the one that you would want to focus the most on. Thank you.